Emotional abuse can profoundly affect the brain, influencing both its structure and function. These changes often result in significant emotional and cognitive challenges for those who have experienced such abuse. One of the primary areas impacted by emotional abuse is the hippocampus, a region crucial for memory and learning. Chronic exposure to stress, which often accompanies emotional abuse, can lead to elevated levels of cortisol, a stress hormone that negatively impacts the hippocampus, potentially causing it to shrink. This reduction in size can impair memory and learning abilities. Another critical area affected is the amygdala, which plays a key role in processing emotions and fear responses. Emotional abuse can cause the amygdala to become hyperactive, leading to heightened anxiety, impulsive behavior, and an exaggerated fear response. This hyperactivity can make individuals more susceptible to stress and anxiety disorders. The prefrontal cortex, responsible for decision-making and impulse control, may also be affected by emotional abuse. Underactivation of this region can result in difficulties with planning, decision-making, and controlling impulses. This can manifest as impulsivity or poor judgment in various situations. Functionally, emotional abuse alters the brain's stress response system, making it challenging for individuals to regulate their emotions effectively. This dysregulation can lead to chronic stress and maladaptive coping mechanisms. Additionally, the brain's ability to form new connections, known as neuroplasticity, can be diminished, making it harder for individuals to develop new coping strategies and perspectives. Psychologically, victims of emotional abuse often experience emotional dysregulation, which can manifest as either emotional numbness or heightened sensitivity. This dysregulation affects empathy and self-awareness, complicating interpersonal relationships. Long-term exposure to emotional abuse is also associated with an increased risk of developing mental health issues such as depression, anxiety, post-traumatic stress disorder, PTSD, and substance abuse disorders. Beyond psychological effects, emotional abuse can have lasting consequences on physical health. Individuals who have experienced prolonged emotional abuse may face increased risks for heart problems, high blood pressure, and chronic pain conditions like fibromyalgia. The psychological scars left by emotional abuse can lead to difficulties in forming healthy relationships and maintaining self-esteem throughout life. These enduring impacts highlight the importance of recognizing and addressing emotional abuse early on to mitigate its detrimental effects on both mental and physical well-being. The long-term consequences of emotional abuse extend beyond immediate psychological and physical health issues, affecting various aspects of a person's life. One significant impact is on interpersonal relationships. Individuals who have experienced emotional abuse often struggle with trust and intimacy, making it challenging to form and maintain healthy relationships. This difficulty can stem from a deep-seated fear of vulnerability and rejection, which are common aftereffects of abuse. Self-esteem and self-worth are also frequently compromised in those who have endured emotional abuse. The constant belittling, criticism, or manipulation characteristic of emotional abuse can lead individuals to internalize negative beliefs about themselves. This internalization can result in persistent feelings of inadequacy and self-doubt, which may hinder personal and professional growth. In the workplace, these effects can manifest as difficulties in asserting oneself, setting boundaries, or pursuing career advancement opportunities. The fear of failure or criticism may prevent individuals from taking risks or advocating for themselves, potentially limiting their career potential and satisfaction. Moreover, emotional abuse can lead to maladaptive coping mechanisms such as substance abuse, overeating, or self-harm as individuals attempt to manage the overwhelming emotions and stress resulting from their experiences. These behaviors can create additional health problems and further complicate efforts to heal from the abuse. Recovery from emotional abuse is possible, but often requires a multifaceted approach involving therapy, support networks, and self-care practices. Therapeutic interventions such as cognitive behavioral therapy, CBT, can help individuals reframe negative thought patterns and develop healthier coping strategies. Support groups provide a sense of community and understanding, helping individuals feel less isolated in their experiences. Self-care practices like mindfulness, meditation, and physical exercise can also play a crucial role in healing by reducing stress and promoting emotional regulation. Over time, these efforts can help rebuild self-esteem, improve emotional resilience, and foster healthier relationships. Ultimately, understanding the profound impact of emotional abuse on the brain and overall well-being underscores the importance of early intervention and support. By addressing the effects of emotional abuse comprehensively, individuals can begin to reclaim their lives and move toward a healthier future. As individuals embark on the journey to recover from emotional abuse, it's essential to recognize that healing is a gradual process that varies for each person. The path to recovery often involves several stages, each requiring patience and self-compassion. Initially, acknowledging the abuse and its impact is a critical step. Many individuals may struggle with recognizing that they have been emotionally abused, especially if the abuse was subtle or normalized within their environment. Education about what constitutes emotional abuse can be empowering, helping victims understand their experiences and validate their feelings. Once the abuse is acknowledged, seeking professional help can be invaluable. Therapists specializing in trauma and abuse can provide a safe space for individuals to explore their emotions and experiences. Techniques such as cognitive behavioral therapy, CBT, or eye movement desensitization and reprocessing, EMDR, can be particularly effective in addressing trauma-related symptoms and reshaping negative thought patterns. Building a support network is another crucial aspect of recovery. Friends, family, or support groups can offer emotional support and encouragement. Sharing experiences with others who have faced similar challenges can foster a sense of belonging and reduce feelings of isolation. It's important for individuals to surround themselves with people who respect their boundaries and provide positive reinforcement. Developing self-care routines is also vital in the healing process. Regular physical activity, a balanced diet, and adequate sleep contribute to overall well-being and resilience. Mindfulness practices such as meditation or yoga can help individuals stay grounded and present, reducing anxiety and promoting emotional regulation. As individuals progress in their recovery, they may begin to rebuild their sense of self-worth and identity. This involves challenging internalized negative beliefs and replacing them with affirmations of self-love and acceptance. Engaging in activities that bring joy and fulfillment can help reinforce a positive self-image. Setting boundaries is another important skill to cultivate during recovery. Learning to assert one's needs and protect oneself from further harm is essential for maintaining mental health and preventing future abuse. This may involve reevaluating relationships and making difficult decisions about whom to keep in one's life. Ultimately, healing from emotional abuse is about reclaiming one's power and autonomy. While the scars of abuse may never fully disappear, individuals can learn to live fulfilling lives despite their past experiences. With time, support, and self-compassion, many find that they emerge from the healing process stronger, more resilient, and better equipped to face future challenges. As individuals continue their journey of healing from emotional abuse, it's important to recognize the transformative potential that lies within this process. Although the path can be challenging and fraught with setbacks, it also offers opportunities for profound personal growth and self-discovery. One of the most empowering aspects of recovery is the ability to redefine one's narrative. Survivors of emotional abuse often find strength in rewriting their stories, shifting from a focus on victimhood to one of resilience and empowerment. This shift can foster a renewed sense of purpose and direction in life. Embracing this new narrative often involves exploring personal passions and interests that may have been suppressed or neglected during the period of abuse. Engaging in creative pursuits, volunteering, or pursuing new educational or career opportunities can be incredibly fulfilling and help rebuild confidence. Forgiveness, both of oneself and potentially of the abuser, can also play a role in healing. It's important to note that forgiveness is a personal choice and not a requirement for healing. For some, letting go of anger and resentment can be liberating, while for others, maintaining boundaries without forgiving may be more appropriate. Ultimately, the goal of recovery is not to erase the past, but to integrate it into a broader understanding of oneself. This integration allows individuals to acknowledge their experiences while not allowing those experiences to define them entirely. By doing so, they can move forward with greater self-awareness and emotional resilience. As survivors reclaim their lives, They often become advocates for themselves and others who have experienced similar challenges. Sharing their stories can inspire hope and healing in others, creating a ripple effect that extends beyond their own personal journey. In conclusion, while emotional abuse can leave deep scars, it does not have to dictate one's future. With time, support, and perseverance, individuals can heal and thrive, transforming their experiences into sources of strength and wisdom. The journey may be long and complex, but it ultimately leads to a place of empowerment and renewed possibility. Thank you for watching. Please subscribe.